welcome to my channel. My name is Lisa Alistway, and on this channel, you will find a variety of inspirational and informational videos. So if that sounds good to you and you haven't subscribed, please subscribe. My guest today is Dr. Dian Ginsberg. Dr. Ginsberg is a board-certified OB/GYN and anti-aging and regenerative medicine specialist. She's the author of the PCOS Environmental Roadmap and the founder of the Ginstitute of Functional Medicine located in Houston, Texas. I will be linking her website down below for your reference. Welcome, Dr. Ginsberg.
Thank you so much for having me.
Yes. So just to kind of get started, I had mentioned in the intro that your background is in OB/GYN, and you've kind of migrated over to this functional medicine side. Can you share a little bit of your history and background on that?
Sure. So I always tell people that I was an OB/GYN resident before any of the laws came out that said you can only have an 80-hour work week or you can't overwork the residents. So I did 4 years of college, 4 years of medical school, 4 years of residency where we were working hundreds of hours a week. And I tell people I brought my probably Krispy Kreme eating. I trained at Wake Forest where we used to eat Krispy Kreme donuts and drink coffee till all hours of the night so I could stay awake to do 15 C-sections all night, to kind of my personal life when I delivered my first son. And that probably disrupted microbiome was passed on to him, right? Because we know that bugs in mom pass on to bugs in the baby, become the microbiome of the baby. So the combination of that plus my lack of education, even as a physician, of food and health, we were eating on the run a lot. I was a typical working mom, affected him in a way with, I think, an inflammatory process that my first son didn't talk till he was 3.5. No language, no words, no comprehensive language. I then developed infertility and wound up needing shots and help to get pregnant with my second son. And when my second son was born, he decided not to talk till he was 5. And so I had a kind of issue with both boys, struggles, saw all the docs in the Texas Medical Center, tried speech, tried this, tried that. So I was 40 years old, doing full-time OB/GYN for 10 years with these 2 kids with issues. At that time, the Women's Health Initiative, the hormone study came out that said that hormones are going to give you breast cancer. So all my patients then threw their hormones out because that was blasted all over. And this was about 2002. I wound up with miserable patients and these 2 non-talking kids. There was a small compounding pharmacy next to my office that started to use bioidentical hormones. And he said, you got to learn, come on, I'll explain a little bit to you. I mean, it was so long ago, he actually gave a DVD on it when we still were using DVDs. And I was trying to bring that concept of understanding hormone replacement and understanding aging in a healthy way to my patients. Said, oh my God, I don't know what I'm doing. I Googled hormone replacement therapy conference because I wanted to go to a conference to learn more, and the American Academy of Anti-Aging came up. And I flew to the meeting and sat through a couple courses, and my life changed. They talked about gut microbiome and omega and vitamin D and nutrients and inflammation and hormone balance. But they then even started to get into real brain inflammation problems in kids and autism and learning problems. So I took all that and I brought it home. I did more of the bioidentical hormones with my patients as I learned. And I took all the other therapies to the boys, pulled them off gluten, pulled them off dairy, ran their nutrient deficiencies, got them outside, got their vitamin D therapeutic, and the language came. They changed. And we worked on that. We still work on that every day. And to this day, my little one, who they told me had an IQ of 47, was severely mentally retarded and would never talk, just graduated Southwestern University in Georgetown. And my older one, who had bad dyslexia, is a 3rd-year medical student at UTMB in Galveston. So I've seen massive changes that happen when you really apply not meds, not drugs, but really change lifestyle. And then now we're seeing more and more aging problems, right? So we're watching the world get older, but yet we're not doing anything to support aging. So what I started to do in my practice is integrate this into the menopausal female. because I think the poor OB-GYN is so busy with surgery and babies and hysterectomies. And you'll see women now in their 50s come in and go, well, hormones are going to kill me, which is not true, because all the literature has debunked that. And the OB-GYN doesn't have time to talk about it. So they're like, I'm miserable. I can't think. I don't feel good. We know that Alzheimer's and Parkinson's is linked to low hormones. So women are suffering, and then they're getting sick, and nobody is out there really trying to support them. So we see everybody, or we do our videos for everybody, from working on getting your kid healthy and your kid's gut healthy, taking care of teenagers whose diet is off, which causes them to develop PCOS, right? Polycystic ovarian syndrome is huge, and it doesn't just come on you, it develops based on your lifestyle. And then really trying to help that woman in her 40s, 50s, and 60s age as healthy as she can. It's right. It's not just being alive. It's rectangularizing aging, where you can be fit and healthy and don't feel that weight gain problem. So, and we do a lot with infertility. You get the gut in line, you get nutrients in line, and all of a sudden, you don't need IVF. So it was really my trial from the boys and dealing with aging females that have moved me down this road. And there's so many people that really need that kind of help and feel very frustrated in the medical community that they can't find it.
Mm-hmm. So just to kind of break it down for the lay person that is like, what is functional medicine? How is that different than just medicine? What would you say?
So I think I always say that we go to medical school and you learn functional body, right? You learn functional biology and chemistry and biochemistry. You learn how the body functions. And it's really no different than the way your car functions, right? The alternator has to talk to the carburetor, has to talk to the starter. It's basically an engine with good gas flowing through it. And that's really what you learn in medical school. Now, you get into residency and you become more disease focused. But the problem with the disease focus is that doctors are short on time. So their issue is, you've got these 5 symptoms, and now I've got this pill that's going to put a Band-Aid on this problem, and then hopefully you won't feel as bad, but now you got a pile of meds. And eventually, I always say it's like the boy with the hand in the dike. You can put your finger in here and put your finger in here and put your finger in here, but eventually the water is going to come through. So what functional medicine does is it goes really back to root cause problems. It tries to say, okay, if your brain isn't working the greatest, and we give you the Parkinson's or MS or Alzheimer's diagnosis, why did the brain work when it worked, and what's missing now? Do you have inflammation from your diet, from your gut, tracking into your brain, prevent it from working? Do you have, I always talk about the body having a cost of doing business. Do you not have enough healthy nutrients? Are you not eating enough vegetables? Do you not have enough sunshine? Do you not have enough downtime? I realize there's stress in everybody's life, but how do you modulate that? So if that's broken, then the body won't function. So what functional medicine tries to do is, from a support system and testing, you can do a stool sample to look at your microbiome. You can do a blood test to look at your nutrient deficiencies. You can do a saliva or a urine test to look at hormone problems. So what functional medicine tries to do is use a combination of testing and support system to figure out what is broken, fix the broken piece, put it back together, and then the body should function. So that's how we look at it. It's real medicine. I'm an MD. I still take my OB-GYN boards every year and make sure that I'm board certified. And most of us will prescribe. We're not against medicine. I have a lot of patients on thyroid meds. I have a lot of patients on hormones. I do use metformin, which is blood sugar stabilization. So we're not against medicine. And I do have patients on antidepressants. But what we're trying to do is say, okay, you don't feel great. You're on a bunch of these meds. What can we do to maybe decrease your cost of doing business so we can minimize your medicine, or at least get your medicine to help you feel better? Because I see a ton of people that come through my door that say, I'm on these 15 pills and I still feel terrible.
Mm-hmm. Yeah. So it just kind of reminds me of, how we have a westernized model of medicine that's very scientific, peer reviewed, really hone in on that organ, the heart, the liver, where versus like the Eastern model of medicine is more holistic, the whole person, and looking at, all the surrounding causes of why your heart's not working, or surrounding causes why your liver's not working. So when thinking of functional medicine, is it just kind of the marriage of the Western and the Eastern model of medicine?
Yes, and it's actually very interesting. I listened to an evaluation of a paper the other day. They were looking at quercetin and fisetin, which to look at it from an anti-inflammatory and an aging standpoint. And the person that evaluated it looked at this study that said it worked and turned around and said, it doesn't work, but look who sponsored the study. So we do make a big deal in our medicine to say, okay, we're going to look at peer-reviewed scientific papers, but half of those papers are sponsored by drug companies anyway. It works because they want it to work. So it's a marriage of both. Yeah, it looks at acupuncture, it looks at grounding, it looks at how EMFs affect us. But there's also a marriage in the middle, because you'll see plenty of peer-reviewed papers on the microbiome, on probiotics, how it helps things. And then you'll see the peer-reviewed papers on drugs. But again, so much, I think this day and age is driven by the almighty dollar, that you got to be really careful even what you read in peer review. And most of the time, if you take somebody and go, okay, look at the 5 things going on in you. Are you getting enough fish, enough omega-3s? Are you taking a probiotic? Are you varying your plants? Are you getting 8 hours, 7 to 8 hours of sleep? Are you calming before sleep? I mean, there's peer review on how important that is, as well as, Eastern medicine. So it's a combo, but I almost think our Western medicine has gone so deep into drug land that there's so many papers out there why the other is important. It's just gotten lost in the mix.
Mm-hmm. So that brings me to my next question with regards to costs and insurance and coverage of functional medicine, like what's covered, what's not covered. Will it ever be covered is the question in the future. What are your thoughts about health insurance and coverage of functional medicine?
So I think part of the problem, and it's a combination. I take insurance. So to see a patient in my office, you can come in with your insurance. So you're going to run into, with functional medicine, 2 problems. There's people out there that are not MDs that have kind of a certificate, a functional medicine certificate. They'll do, say, their 10 courses through the Institute of Functional Medicine. And if they don't have a medical degree behind them, they will offer functional support, but they can't take insurance. So you got to take a step back and look who you're getting your info from. There's a lot of chiropractors that practice functional medicine, and a lot of them are very good at what they do, but they can't take insurance. So where sometimes where the problem is, you'll have the MD group over here, but then you'll have a lot of other practitioners that can't take insurance even if they wanted to. Within the MD group, one of the big reasons we run into insurance issues, and I struggle with this, is because insurance covers, you have a problem, what's your problem? Single problem, go over it in 20 minutes and walk out the door. And you really, in a functional model, can't do that, because you can't find the root cause. It would be like telling a psychiatrist or a psychologist, if you go to a therapist, you got 1 visit to solve my 20 years of trauma. It's just not doable. They'll say, you got to come in, then you got to come back in, then I got to get a better background, then we have to work through this. So functional medicine is sort of in that concept of, I can't fix, I'm 50, I'm overweight, I'm fatigued, I have no libido, I can't sleep, I can't fix that even in an hour visit. So if it took you, 35 years to get there, I can't fix it in 1 visit. So part of the problem, I think, unfortunately, is the expectation of the patient walking through the door. If patients come in thinking, I've got a problem, I've got a bunch of things going on, because I'll see that I tell people when they come to see me, give me 3 reasons why you want to see me. And some of them write fatigue lifelong or last 20 years. I can't fix that overnight. So you have to be ready to say, even to somebody that takes insurance, I understand that I have a deductible, and I understand my deductible is, $5,000, and my visit's going to cost me $250, but maybe I need to do 2 or 3 visits till you get an idea of what's going on, just because it becomes a time issue, because everybody's got to pay their light bill. So I think that's problem number 1. So we try to make it affordable as much as we can, but it's a different model than, hey, I got a spider bite, can somebody give me an antibiotic ointment for it? Number 2, what happens is we're at the mercy of the testing company. So if you are going to have a blood problem, let's say I'm bleeding heavy and I think I'm anemic, right? I've got heavy periods, say if you're a female. Well, you're going to go to LabCorp and you're going to get a CBC, a blood count, and we're going to find out if you're anemic. Insurance kind of recognizes that connection because I've got something broken, try to fix it. Whereas the problem you run into with functional medicine, when you're looking at your microbiome for a non-specific dysbiosis or bug dysfunction, not I have Montezuma's revenge because I went to Mexico and I got diarrhea, that lab doesn't take insurance. The same way kind of Whole Foods doesn't take insurance, right? You can get food stamps and you can get support there, but you can't go to Whole Foods and say, I want that better quality peach, if you would, that's organically grown, and I want somebody else to pay for it. You sort of realize that if you're going to move in that direction, you've got to understand it's going to cost you a little bit more. So the testing makes it a little bit more difficult for us. But the way I like to look at it is that you will wind up ahead in the long run, because if you say, hey, I've got a bad gut, I don't feel good. If I do the test and I spend a couple of visits with this functional doc and I do what they tell me. I got a lot of patients that come back for their visit and go, it's too hard. I can't fix that.
Yeah.
I can only do what I can do. I can turn around and say, if you're 52 and you don't have periods anymore, you will develop insulin resistance. You will gain weight easier if you're menopausal. So if you're now 150 pounds and you want to be 120 and you're frustrated by your weight gain, you have to watch what you're eating differently. You can't drink 2 glasses of wine every night, even though you want to. You have to exercise 6 days a week. You have to lift. So I do believe in my heart and in my mind that if people would listen to what we say and go out and do it, the cost really wouldn't be that bad, because it would be a little bit upfront, but they would get better in the long run, and then they wouldn't be in the hospital sick with heart problems.
Mm-hmm. No doubt our healthcare system is broken. And like you said, there's a limited time with doctors, and also a limited schooling and education amongst a lot of doctors with regards to modifiable risk factors, lifestyle factors that people need support with in how to make those changes in their life.
That's a very interesting statement. But one of the big take homes that I want to get from this, that I would like people to hear, is that's not your doctor's job. Mm-hmm. And I told a patient that it's not your doctor's job to tell you how to eat better, to tell you how to get better. That's not. They're there like good old Michael J. Fox and Doc Hollywood. Remember how he kind of ran the whole town, right? The family doctor used to be able to do that because their job was, let me fix you after the tractor accident. Let me deliver the baby. Let me deal with the fact that you're sick. You need to, here's my problem, fix it. So I do have patients that say, well, my doctor doesn't listen or doesn't tell me what to eat. That's not their job. If you struggle with that, then you need to go to a nutritionist and say, I need you to help me with meal plans. And you may have to pay that nutritionist, but that's what you have to do for that service. If you feel like you can't lift, then you can use YouTube, because there's tons of videos to help you do your strength training, or you have to pay for your trainer. So I think there needs to be a little bit of a mindset shift of the patient, that you can't walk in for a $20 copay and expect your entire life to be turned around. And I feel pretty strongly about that, because I love what I do and I'm a good doc, but I can't fix your life. It takes a village to do that, and you have to be aware of that. And like I said, it's not your doctor's job to tell you how to eat. It's the doctor's job to say, I can support this and show you how to get started, but let me give you some nutritionists to help you on a day-to-day basis.
Mm-hmm. Very good. So I was looking at your website. You offer a number of services, and one of them that really caught my eye, because I'm in this age demographic, and that is the perimenopause, menopausal stuff, the hormone stuff. You have a lot of great information on your YouTube channel. Can you kind of touch on how functional medicine would be helpful for that demographic?
Yeah, so it's actually where my biggest passion is, because I think that the OB-GYN space doesn't have time for it. So what actually happens, the understanding of perimenopause and menopause is in the medical literature, but it's not passed on, unfortunately, to the doctors. Like my son is a third-year medical student, and if you look at what he's learned as far as how the female system ages, or the OB-GYNs, I did OB-GYN for 25 years, we need to be taught to be technicians. You have to be a surgeon. If somebody has a postpartum hemorrhage, they deliver a baby and then they try to bleed to death, it's really scary. And I don't care how many years you did it. So you need to be able to be a really good surgeon. So if you're going to be a good surgeon, it's very difficult to delve into the latest and the greatest of what's going on with the aging female. So what happens is the old study back from 2002 that looked at hormones, looked at oral Premarin, oral estrogen horse pea, and oral progestin, which is not progesterone. It's what they take out of birth control pills. And they gave that to women that had been off hormones for years. The average age in that study was mid-60s. And if you give somebody that is older, a smoker, and not been on hormones for 10 years, a oral pill, they will have blood clots. They will have problems. And if they have a bad gut and they can't metabolize the progestin down the right road, then they will make bad metabolites, which increase breast cancer. So that study has just paralyzed women from taking hormones or from advocating for themselves to say, wait a minute, I feel different in my 40s and 50s. So what happens to the female body with aging is that the connection of the brain to the ovaries starts to weaken. So if you think of yourself as nothing but kind of a connected machine that's functioning, that starts to fall apart. So you have non-functioning ovaries when you're a baby, it connects up and they get a little irregular when you're a teenager. It stabilizes, but then at 40, as your DNA gets older, the ovary can't be controlled as well as it used to, and you start to get this fluctuating ovary. From 40 to 50, when that fluctuates, if your gut's not in a great place, if you have a lot of stress, depending on your genetics, all of that will make it harder for you to tolerate that fluctuation of estrogen, and you don't feel good. You may gain weight. You may struggle with sleep. Maybe your stress creates detox problems. And then if you don't ovulate as well, your progesterone's low and now you have bad PMS. So I want to address that because I want to address that demographic, because that demographic in traditional medicine is either number one, going to get put on birth control pills. You do not want to do that. You've got a system that's dysregulated that can't handle the hormone fluctuation. The last thing you want to do is take the pill. And then your OB-GYN is just going to say, take that, it'll regulate you. Now, not that I'm against the birth control pill, because if you're 43 and you take the pill because you need it for birth control and you're doing fine, I'm not against that. But I don't treat hormone problems by giving somebody the pill. So I want to take that demographic and say, hey, let's look at what's going on in your blood. Let's look at what's going on in your gut. I do a lot of saliva testing. Saliva testing can indicate what's going on at your tissue levels. Are you a detox problem? So a lot of times when you look at that particular demographic, when you detox them well and you clean up the gut more and plus minus support a little progesterone, they feel better, their weight comes off, they're okay. And so I want those people to understand what's going on at that time. So I try to educate while I treat that. And then if you get that progesterone balanced with the estrogen, often the anxiety and all that other stuff that comes along with perimenopause gets taken care of. And what women don't understand is that the drop in estrogen, the fluctuations, really affect the central nervous system. And about 20% of women can't handle that. So if you feel a little off or depressed or anxious and not yourself and you're 45 years old, guess what? That's okay. Because you have to liken it that if somebody gave you $10,000 to live every day, and then all of a sudden one day they turned around and yanked it, you wouldn't know how to pay your mortgage, what to do, how would you live? Well, that's what happens when the estrogen yanks. The brain can't handle it. So I want to address that to keep that group healthy. Group number two, once the ovaries really disconnect and burn out, there's 10 nuclei in your brain that function based on estrogen. So it's not just about hot flashes. The one part of the brain, you can't sleep if you don't have estrogen. The part that helps your memory grow, you need estrogen. The part that helps you integrate your memories. Women go, man, I got this word recall problem. The part that helps you modulate your body temperature so you don't have those hot flashes. All of those are like gas in your car. It doesn't matter if you have this perfect Maserati, if you don't put gas in your car, all that other stuff doesn't work. And women have been told, well, just it's getting older. I'm 57, I'm going to be 58. I'm training for another marathon. My brain is good. I feel good. But why? Because my estrogen level is elevated and tested. I use salivary levels and urine levels to compare menopausal women to somebody in their late 40s. And I think if you just bring somebody back to that estrogen level, the brain doesn't understand the difference. It functions well. And when you use urine, you can look at detox products so you can see that they're going down the right pathway and that they're not a breast cancer risk. So I think that whole demographic can understand what their strengths are, what their weaknesses are. And when you support that, they will feel good well into their 70s, 80s, and 90s.
Yes, yes. My understanding is very complicated because it's an individual approach. Every
Right.
woman is different and is going to require a different treatment plan. I know on your website and your YouTube channel, you talk about bioidentical hormones, which I have a question about, as well as testosterone replacement. I'm seeing some women getting that done and getting these testosterone pellets put in them. What are your thoughts on that?
Okay, so I feel very strongly against pellets. And I appreciate your asking me that. So what you have to remember, if you look at an uncomplicated walking down the street, 25-year-old woman that can have a baby, her average blood testosterone level is 21. The medical literature supports it. So LabCorp average numbers are 10 to 55, but that healthy lady has a total testosterone of 21.
Yeah.
If you look at somebody that's got dysregulated blood sugar, hair growth, polycystic ovarian syndrome, which acne, which leans towards an androgen or a testosterone problem, their average testosterone is 36. When you get a pellet, you're walking around with a testosterone of 150.
Whoa.
Low normal in a man is 150. Right? I've got guys that walk around 250 as they get older. So here's what happens. If you take a perimenopausal or early menopausal woman and you give her testosterone back to the level of a younger person. So let's say that particular woman has a testosterone, maybe low normal of 10, and you give her a little bit of testosterone and you bring her back to 25, you'll see no libido difference. If you take that woman with fluctuating estrogen problems and you stabilize her estrogen and you get it out of that menopausal range and get it right to that early perimenopausal range, her libido goes up, she feels better. Now, what I think happens with the pellet is that if you shoot somebody with that level of testosterone, you're doping them. That's what it is. You're blood doping them, right? If you were going to go do a race professionally, they draw your blood and they throw you out. It's an abnormal level. So what happens? The cells in the body have what's called family receptors. So estrogen, progesterone, DHEA, cortisol, fatty acids, vitamin D, all sit on that same receptor. So that's giving messages to the cell, right? To each of your cells. Do this, do that. Well, think about it. If you start shooting high levels of testosterone in, it's going to kick everything off the receptors but itself. So now you're going to have this overwhelmed cell full of testosterone. So what does it say? Procreate, make a baby, right? So what'll happen is these women won't feel good. Then they get doped with this pellet, and all of a sudden, all they want to do is have sex 24/7. That's all it is. And what happens when you feel that? You don't eat.
You don't eat. You
right?
lose weight, so you feel good, or you think you're feeling good, but you're masking a lot of symptoms, I guess.
I believe the other word that they would use for that would be crack. You shoot and take crack, and I'm great, and I'm up, and I'm good, right? So that's really what happens. But the body is a very, very smart thing. So what do you think happens? The female body goes, oh my God, look at all that. I'm getting overwhelmed with testosterone. So the receptors pull back. So the next time you get your pellet, your high isn't as high. You don't feel quite as good. In order to get that, they got to shoot you higher. So that's why what it'll start, right? So typically what will happen down the road is now you start to get androgenic. You start to look masculine. Your weight will eventually pull on your belly a little. I've got a couple patients that then when the crash comes, they feel so bad they have to go back. Their skin gets greasy. It's abnormal. Now think about what you're putting on your liver, the stress that you're putting on your liver, because your liver's got to detox this. And what starts to happen? Estrogen fluctuates. They never run the estrogen as high as the testosterone, relatively speaking. So now you've got the testosterone estrogen profile of a guy. Now, what are you at? Heart attack risk. Because instead of all that estrogen doing its job. So problem number one with the pellet is all of that other with the testosterone. Where I also have a problem with the estrogen level is that what happens with the female body is the way your brain and your memory stays healthy is through estrogen fluctuations. It's documented. So if you take somebody and you shoot them up with that pellet and you don't give them fluctuations, because when I give hormone replacement, I always have them take a couple days a month, 1 day off. So you freak out the brain a little. Your body doesn't feel it, but the brain notices the drop, and the literature says that the memory center upregulates with that. Plus, you can't judge what level of estrogen you give somebody in a pellet because you don't know what you're comparing to.
Right. They're not FDA approved or regulated. Is that correct?
So you got to be so the bioidentical hormones aren't FDA approved either, but you have to be careful with that because the problem is the FDA is only going to approve it if they turn around and say, okay, I took 5,000 women and I gave them 0.625 of Premarin, and somebody gave me $1 billion to run this study, and I track this and I track that and I track this, and their hot flashes got better. Once you start bioindividualizing, you run into a little trouble with the FDA. And I think that's where the compounded bioidentical hormones get into trouble because it's not a one size fits all. Where I have a problem with the pellets is what they're doing with them. Whereas for me, when you look at somebody in their 20s, 30s, and 40s, and if you would look at an ovulating female through that time, and on her post-ovulation day. So the way the female system works is that the brain says to the ovaries, okay, we just had a period, no baby, let's try to do it again. So the brain will say to the ovaries, let's hit it. So the ovaries spike a little estrogen, then they ovulate, then you get a big progesterone estrogen surge, right? That's where you would implant your baby if you were pregnant. Then it drops back down again and you have a period. So if you look at a woman in her 20s, 30s, and 40s, and you were to do a 24-hour urine on each decade of those women at day 19, 20, or 21, their estrogen progesterone levels are basically the same. You don't lose hormones in your 40s, you lose that connection. So even though the compounded bioidentical hormones aren't FDA approved because you can't have masses of people taking the same dose, because I want the woman who's 52 to just be at that low range of that ovulated 47-year-old. So you may need this dose. She may need this dose. There's 2 estrogens that keep your brain functioning, estriol and estradiol. The drug companies only make estradiol. They haven't figured out how to patent estriol. But if you don't give that combination in the perfect balance to each individual woman, you're not hitting the receptors in the brain perfectly and you're not maximizing who she is. But again, because everybody's a little different, how do you do the study? And Big Pharma doesn't own the compounding people. So nobody's going to give the money to do the study. So the reason I have a problem with the pellets is the doping, is the levels that they're doing. If somebody came along with a way that said, I've got a magic pellet that I could put in and I'm looking at a urine level and I'm comparing it to somebody in their 40s and I'm making sure that the brain is getting pulsed at and the testosterone isn't jacked through the roof, I wouldn't have a problem with it. It's more about what they do and the levels they're doing and kind of what they're selling to women that I have a problem with.
Yes. So important to, as a consumer, it's very confusing because you hear this, you hear that. And it's good to have a relationship with the doctor that you trust and realize it is an individual plan. Do not compare yourself to somebody else. And it's very confusing sometimes, I think, as a consumer.
It's huge because you're going to go to your OB-GYN who's going to go, well, if you don't have hot flashes, don't take anything. Because even the OB-GYN that is coming straight out of training, her issue or his issue is hormones cause breast cancer. And actually, a very important take home, hormones don't cause breast cancer. The microbiome of women with breast cancer is very different than the microbiome of women without. That is all over the literature. So it's not the hormones that are a problem. It's when you spike your estrogen, how you're metabolizing it. Because if hormones were the problem, then everybody with the BRCA mutation would develop breast cancer. And 50% of people that have the BRCA mutation don't get breast cancer. So the only way you can explain that is that their epigenetic or their environment around their system is not a problem. So therefore that slow offload of bad estrogen isn't a problem because they're just not making that much of it. So I think as a consumer, it is really hard because it's still, women are still walking around terrified of hormones. And that's what really upsets me, because if you're going to have this aging community that is not taken care of. And I think one of the reasons Alzheimer's is elevated is because those women in their 70s were 50 when the Primrose study came out. So they all threw their hormones out and didn't take them anymore. And now they're 70, they're 20 years out. And that's why it's going through the roof. And, you know, it's sad. They don't want to talk to women about hormones, but then Biogen comes out with that horrible drug that says, oh, your brain will bleed, but maybe we can help your Alzheimer's a little bit. So find somebody that really understands hormones. If your OB-GYN doesn't understand it, and that's not what they're doing because they're delivering babies, find somebody that can really give you an understanding of who you are, what your gut looks like, and what are the right hormones for you.
Yes, yes. Another service that I see that you offer is addressing anxiety, which I think is, I mean, who doesn't have anxiety? And, you know, the traditional medicine, when you go to the doctor and go through, you know, their series, their screenings, they're ready to maybe give you a pill and send you on your way. I guess with functional medicine, we're going to like, hey, let's hold the pharmacy route back first, and let's look at other things to address the anxiety. Can you touch on how you look at anxiety and helping your patients?
Yes. So the best way that anybody, I think, should look at kind of anything anxiety is to take a look at the brain. And here's a good way to look at the brain and why this comes forward. So if you think of your brain as nothing more than your computer, right? A plain computer. So when I open my computer, there's nothing on it. I type the email. I type the letters. I pluck what I want to get across. And then the computer responds. So the way your brain responds is you take in the world, but you react to that based on what's going on in your gut. That's what people talk about, a gut feeling. So your brain will balance, if you would, your world in terms of, do I fight? Do I flight? Do I run? Do I sleep? From something called neurotransmitters. And there are different neurotransmitters that will make you react a certain way. So think about it this way. Your gut will be in a certain state of being when you are calm and relaxed. Your gut will be, and the bacteria or the microbiome that are in your colon, in your gut, will be in a certain way when you're relaxed. They will be in a different way when you're running a marathon or running from the tiger or running from your life, for your life. They will be in a different state when you are sleeping. So they will make these different neurotransmitters to trigger the brain what to do depending upon what's going to keep your body alive. So your neurotransmitters, you have different ones. You make dopamine, that makes you happy. That's your motivational neurotransmitter, right? I always tell people that's like Starbucks. That's what they do. When you drink a Starbucks caramel macchiato, that's going right to your central nervous system. So you want more, right? That's your dopamine. Now, serotonin calms you. That comes up when insulin comes up, because you've gone out and you've hunted and gathered and you got your food and you're paleolithically with your family and you found shelter and you eat. Now your insulin comes up, and so you'll sleep so you can hunt and gather tomorrow. Norepinephrine says, let's go. The gut's knotted, and norepinephrine and epinephrine are saying you got to run and fight and war. So that's going to elevate. So if you think of your body as a bunch of balanced neurotransmitters, you will be anxious when you should be, which would be a disaster is coming your way. Where I think people get into trouble is that their gut gets off, so the neurotransmitter balance is off. So the bugs are making too much of one neurotransmitter than another. There's a if you can ever listen to anything on YouTube, if you want to listen to the microbiome, there's a wonderful lecturer, and his name is Kiran Krishnan. He's actually the PhD of Microbiome Labs. And he said, the bad guys are always fighting for real estate. So you've always got the bad bugs that want you to have diarrhea, because then they can take over. And those guys contribute to the neurotransmitters that make you anxious. So you're not your gut. So you have bowel movement issues. So they can take over. So understanding that connection will be, if you're eating a lot of sugars, if you're not eating enough variety of plants, if you are working the night shift, there's a big circadian rhythm dysregulation. If you're working crazy hours and you get up at 4 o'clock in the morning to do your exercise, and your REM sleep, which you get in the morning, is cut short, and the body doesn't reset itself, all of those will mess with your microbiome, and the body will feel this more fight or flight in the gut, and you will make more norepinephrine, and you'll be anxious all the time. That's number one. Number two, a lot of women say, why do I feel more anxious around the time of my period? Right before my PMS, my anxiety comes up then. So the second thing that goes along with that is the same enzyme that offloads your estrogen also balances your neurotransmitters. She's got a double job. So as you push that estrogen up and there's no baby, and the body's got to clean that estrogen out, and especially as you get into your 40s, when you start to get a little more estrogen dominance, that poor enzyme, the COMT enzyme, turns around and says, I cannot deal with the central nervous system right now. I have to take care of this. So that woman may have headaches. She will have more anxiety, more PMS. So because the enzyme can't do the job. And then they go, oh, my period hit and I feel better. My anxiety's better. So that combination is going to either, if your gut's off initially, can give you non-specific anxiety, and it can also get worse before your period. And remember, once you carve the path, then the path continues itself. So I get my gut out of whack, I get more anxious, I develop this anxiety, and then your central nervous system develops problems. It starts carving the same path over and over. So things trigger you more, and little things blow you up more, and then you don't get into your deep sleep. And when you don't get into deep sleep, you don't clean all the garbage out. You don't get that REM sleep, which calms your system. The way you work through emotions of the day that we all have is to REM sleep. So if you're not getting into that because you're crazy when you go to bed at night, or you're not feeling calm when you go to bed, there's another great book that I recommend to everybody, and it's written by a guy named Matthew Walker. He's a big PhD sleep guy, and it's called Why We Sleep. So you can listen to his podcast. It's all on sleep. You can read his book, but he's a big proponent of, especially with anxiety, get in bed 10, 15 minutes early, calm your system. And a lot of people poo-poo that, but it makes a big difference. And again, make sure you're getting that morning REM, because if you're not, then the system won't calm. So what functional medicine is going to do is say, rip those things in your life apart, put them back together healthy, and usually the anxiety resolves.
Very good. Very good. Another area that I know you work on is healthy aging. And I know as we go down the path of life, I mean, each decade looks and feels differently. What are some of the things that you would say to help people with regards to functional medicine and healthy aging?
So I have tried to research as much of aging support as possible, because there's all kinds of theories out there of supplements you should take, and what works and what doesn't, and people are buying stuff off the shelf. So I've researched a lot of the anti-aging supplements and things that people, like, everybody's buying stuff on Amazon. What can you take? You know, what can you do? What makes a big difference? I have not seen anything major in the aging space, separate from getting your hormones therapeutic, getting your microbiome in line, make sure your vitamin D is therapeutic, make sure you're taking your omega to support your cell membranes, take your probiotic. I haven't seen anything major in the aging space that has turned around anything dramatic. So what do I mean by that? One of the biggest problems with aging, and this will make a little bit more sense, is that we can't measure it great. Like, you can't give somebody something until you can measure if it works. If you go into your doctor's office and somebody sticks a cuff around your arm and your blood pressure is 190/110, we know from looking at tons of patients that if you live like that, you get blood vessel problems and you develop a stroke. So I can say, okay, I give you this med, I get you feeling better. Okay, my headache's better, I don't feel as bad. And now I check your pressure and my pressure is now down to 110/70. The problem with aging is measuring what we do to see if it's making a difference. So one of the studies that people look at, or one of the tests that people look at, is something called telomeres. So the caps on your DNA are called telomeres. And I tell people to think of that like the plastic on your shoelace. And when your cells divide, every time they divide, you can't quite cap as well as you did before. And so your ability for your DNA to make proteins goes down. Problem number one. Problem number two, your DNA is very coiled. So the way you cell divide is it uncoils, and then you make your proteins, and then it coils back up again. Well, every time it uncoils, it breaks. So now what happens is you got to put it back together, but then it's like sewing a jacket, right? You don't quite get the jacket looking as good as it did before it had in it. And so again, the ability to look as good becomes a problem. The ability to make the proteins become an issue. So that's our understanding of aging. You take little light bright pegs and you stick it in other points of your cells, and what we call that is called methylation. So that's the best way I kind of visualize that you want the right light bright pegs in the right place. That gets blown up. So until you have perfect testing to be able to say, okay, I did your telomeres, and now I got your vitamin D at this, I got your hormones at this, and I've got your gut at this, and now your telomeres are longer, it's always going to be hard to say what therapy works. So there are people out there that are taking something called NMN. There are people that are taking something called NR. Those are supplements that support the mitochondria, which keep us healthy. There's a lot of controversy about does it work, does it make a difference? Nobody's proven that it's going to reverse any kind of aging, again, because the testing to look how fast you're aging is in its infancy. There are companies that do it. There's a company called True Diagnostic that I'm working with that we're looking at aging. We're looking at interventions. We're looking at different proteins that change. We're doing a study where we're actually removing a liter of plasma from older people and hanging a liter of plasma from younger kids.
I've heard about that.
And looking at the changing proteins. I did a study where we hung young plasma on people with Parkinson's and they got better. And that's in peer review now to be published. So the space is wide open. But because the testing is kind of over here, it's really hard to know if anything is going to make a difference in your aging. So what I tell people for now is run your micronutrients, whatever company you like. I don't speak for any particular company. We use SpectraCell's micronutrients. Genova does a test called NutriVal. Certain functional labs will look at nutrient deficiency, so you in your own diet can see, wow, my B12 is a problem. My B6 is an issue. I need more magnesium, rather than going to the shelf and saying, well, I'll try this, I'll try this, I'll try this. Number two, what you want to do is, I believe very strongly, men and women, you want to get those hormones therapeutic, right? You can do a GI map that looks at your microbiome to make sure that's diverse. So I think the best we sort of have now for aging, intermittent fasting. Nobody's going to doubt that doing a little bit of intermittent fasting is going to make your microbiome freak out a little bit, start kind of eating the lining, mitochondria turnover. So that's going to help. So I think from the aging process, that's where we are. The plasma and some of those other techniques, I think you're going to see a lot in the next couple of years.
Interesting, interesting. So I also think it's interesting for your functional medicine side that you addressed some areas that people are very frustrated with in traditional medicine, like ADHD, where parents don't want to put their kids on Ritalin. Maybe we can approach it in another way. I noticed you addressed that. You addressed autism. You addressed dyslexia. Can you touch on those types of things real quick?
Yeah, I think the hardest thing with that parents struggle with, and I saw it with my own kids, is a lot of the kids that have issues. So what I think happens, because we got the sensory integration disorder diagnosis with both of my boys. So I think the pathology behind this is the specific microbiome that winds up in that baby's gut as you put inflammatory foods in doesn't react well. Why? Who your kid is, what your genetics are, right? Mom gave a gene, dad gave a gene, how the bugs react, how the immune system reacts. So when you put gluten, dairy, sugars, the non-soluble fake peptides that kids eat when they're little into the system, certain people talk about vaccines and this without going down that route, just talking about sort of how to help, I think, kids as much as possible. We think about what's going into the gut. And then the immune system in the gut looks at it and says, who are you? Am I tolerant of you? Are you okay for me? Because some of our peptides in our processed foods are so mutated, problem number one. And problem number two, the pesticide that's sprayed on a lot of our vegetables will kill the bugs. They won't kill you, but the pathway that keeps the bugs off the plant is the same pathway that keeps your microbiome alive. So they will kill that microbiome. So instead of a good, healthy, growing, nutrient-dense microbiome, you've got a lot of inflammation in there. And what starts to happen is the ability of the bugs to clean up the mess from the food and also make the short-chain fatty acids that line the gut gets compromised. And the same way that the literature has shown that bad gut over time tracks up the vagus nerve into the brain to give you Parkinson's, there's no difference here. You've got the brain trying to develop and prune and do its job. And I think it's very difficult to do that when you've got gut dysfunction and inflammation tracking up into the brain. So the pruning and the organization becomes a problem. And I could tell you that's probably exactly what happened to my own kids. So I gave them my not great gut. I've done their genes. Their genetics aren't even terrible. The MTHFR and all the genes that people talk about, my boys, they're not that bad. But it was just enough with the juice sugars and with the McDonald's that we ate. I mean, I'll admit I did that. I was post-call, I was half asleep, and I had to watch the kids, and I brought them to McDonald's and they ate a McFlurry and I was happy. So, and I wasn't as tuned into, I got to make this kid eat vegetables. So I think that's where you get into trouble. Well, now what starts to happen is there's receptors in the gut that say, give me more carbs. And that was paleolithically very beneficial. So if you now hyperstimulate that baby, not only will have brain issues that can't develop, so communication becomes an issue, but they're going to crave towards that. And a lot of times, by the time you get this diagnosis and you get this issue, that kid is 2, 3, 4 years old and their patterns hit. And now to try to get them to eat peas and carrots and some of the other becomes harder. And then even if you're kind of borderline in this diagnosis, now they're going to go, they're 4 years old and they're going to go to Jeremy's birthday party. And that kid's going to go, your baby's going to say, well, I want a piece of cake and I want this and I want that. And you feel like this horrible mother to say, no, you can't eat that because it's bad for you. So what I think starts to happen is then that perpetuates and you'll see it then the brain doesn't function as well. We see it a lot in young women. The girls will struggle and then the next thing you know at 12 their periods are irregular and they've got a weight problem with polycystic ovarian syndrome at 15. It all goes back to the same concept of kind of what this lump of clay was, if you were, and then how it matures. So one of the biggest things I tell parents, which I did with my own kids, is you've got to go back to basics. And if your baby won't eat vegetables, make them a smoothie, not full of fruit, right? Put a little bit of almond milk and then put a bunch of greens in there and maybe a little bit of berries. convection roast the vegetables. If you convection roast them and crisp them up a little bit, then what'll happen is they're not mushy, and you may find them, more apt to eat that. Try to go a little more gluten-free. One of the big problems we have is that somebody will get a celiac test and they'll go, you don't have celiac. Well, it's not about that. It's basically about the fact that if your baby reacts, you don't have to have celiac to overreact to gluten to beat the gut up. So what we try to do is we do a microbiome test on those kids. We run their micronutrient deficiencies, and we work towards, maybe your B12 is low. Like I said, maybe your choline is low. You support what's low, you change the diet, you get the gut in line, and now you take the pressure off the system and the brain can do its job. And you'll see huge changes. My kids eat impeccably clean. They go out and they're both, one's, like I said, in med school, one just came out of college, and you can make it work in college. You can make it work in high school. I think if you really implement this young, that becomes part of what they do. Like my boys don't have to force it. It's just very natural to them because they go, I'm not putting that garbage in my body. So I think that if a parent really works on that day in, day out, I think you can see big changes, and the ADD gets better. It's really about the quality of what you're putting in your kid.
Very good. Well, we're coming here to the end of our conversation. Do you have any final thoughts you would like to share with regards to functional medicine?
So I think that there's a lot on YouTube that you can listen to. Your doctor, even functional medicine practitioner, can be icing on the cake. I think there's a lot of info on YouTube that you can listen to that's going to give you repetitive, same functional medicine concept. Like if you listen to Mark Hyman in the Doctor's Pharmacy, or if you listen to, I'm a big Andrew Huberman fan, if you listen to some of those podcasts and start implementing that, right? Do your breathing, get your sleeping, and make sure you have your vitamin D therapeutic. I have a lot of patients even go to their primary care doc and they say, oh, your D is low. And then they get their D therapeutic, and then the patient goes, okay, I stopped taking it. Well, you got down in the first place, what changed? So for me, it comes down to, there's things that you can learn that you can implement into your own life and that you can bring to your functional medicine doc. By the time you go, you say to them, because I see a lot of people that say, well, I know my diet's terrible. Okay, fix what you can on your own, and you'll get way more out of it. You don't need $8 million worth of tests. I got my D therapeutic. I started on a good probiotic. I don't love vegetables, but I'm working on it. And I tell the average person, you should eat up to 5 cups of vegetables every day. So work on that, because that's what your functional medicine doc's going to tell you. Just because you don't have celiac, pull the gluten and the chips out of your diet more. So my big issue is do everything you can between YouTube and information that you find to get your system in the best place possible. So by the time you go to your functional medicine doc, they'll do 1 or 2 tests on you. Like I would do, say, a hormone test in a perimenopausal woman who's already eating clean, and support her system. Yeah, maybe she needs a little detox help, or maybe she needs a little progesterone to help the end. But that's not fixing the problem. That's icing on the cake. And if you are a younger woman who thinks her hormones are a problem and is going to go to a functional medicine doc for a hormone problem, always remember that your hormones are about the bath that they're in. If you are 35 and you think your hormones are a problem, not every once in a while you'll get somebody with premature menopause, but 99.999% of the time, the reason your hormones are a problem is not that you need progesterone at 30 years old. It's that everything around them is an issue. Look at your diet, look at your supplements, look at your sleep, because I can promise you, I've been doing hormones a long time and hacking my own body, that most of what keeps you strong is what your body is bathed in.
Awesome. Well, this has been really helpful, very informational, and I hope that it inspires somebody to, do their own homework on it and maybe look at other ways than just, popping a pill and having to deal with the side effects of those pills, and addressing their modifiable lifestyle factors, risk factors is going to be super key for them. So thank you, Dr. Ginsberg.
Absolutely.
Yes. And if you guys like this video, be sure and give it a like, and don't forget to comment down below and subscribe and hit the notification bell to be alerted to when the next video drops. Thanks for watching.